Hi everyone. Today was Zometa number 5 out of 6, and my Tylenol is wearing off and my hand hurts and my hot flashes are starting and I'm physically uncomfortable, so I thought I'd vlog. oh, sorry, my whole body just gets like, I'll get to that. It seems like out of all my vlogs, most people have the most questions about the Zometa infusions. Most of the feedback that I get are questions about the Zometa infusions. So I thought in my real time, it'd probably be a couple months before I put this up on YouTube just because I'm behind on my vlogs. I just want to kind of give you a walkthrough as to what the Zometa infusions are like. I've talked about side effects and stuff, but today was the first time, I switched oncologists, and this was the first Zometa infusion I had at the new cancer center that I'm going to, which was a different experience from where I've been going for the other, or had been going for the other 4. My old hospital that I went to for the infusions, it's very like homey, warm, fuzzy. It's where I had my double mastectomy. It's where my gynecologist was. It's where I found out that I had breast cancer. It's where a lot of my care was. I just didn't really vibe with my oncologist, and and her nurse retired, which caused some issues today because she was the one who ordered the Zometa, and now she's not in the system, and they're like, well, we have to have orders, and I'm like, I don't want her to do this all over again and take the time and schedule all this shit out. Anyway, they figured it out. Yeah, where I'm going now is a different cancer center. I kind of don't want to go into specifics as to where I'm going. It's just more businessy there, at least from the few occasions that I've been there. And it was just a different experience. And even though I've had this done 4 other times, you would think I would know the routine of what to expect and everything. It's hard to remember because the Zometas for me are 6 months apart. So that's a long time to have to remember, well, what did I do? And what did I bring? And, what things do you have to make sure you do or not do? And that's why the vlogs actually come in handy for me too, because I'll look back and look at my pictures, even just to see on my, because I'm not going to watch 5 hours worth of Zometa vlogs before I go in for the next one. But if I even look at my thumbnails and look to see what I'm wearing, even what you're wearing makes a difference because of where they choose to put needles and stuff and what you have to wear. Am I usually hot there? Am I cold? You want to be comfortable. And yeah, so I thought I'd give you kind of a play-by-play as to what happened for me today and how that differed from my other infusions, and really standing up for yourself and advocating for things that work. I am 52 now. I was diagnosed when I was 49. I have to say, over those years, I have definitely learned how to advocate for myself and for my body, which I had to do today. I was kind of annoyed that I had to in the first place. It's cut me some slack. But there is a light at the end of the tunnel with, well, I'll hold on to that thought. There was a nice little thing at the end. There was, I use the term happy ending loosely, but it did have a happy ending when they knocked on the door, and I was like, oh, not that kind of happy ending, but it was a, literal end that made me happy as I was finishing up there. Anyway, so Zometa 101, here we go. So again, I'm putting a disclaimer out that I'm not a medical doctor or anything. Don't take my advice. These are just my, or I shouldn't say don't take my advice, but these are my experiences that I've had and things that I've learned from doctors and reading and support groups and all this stuff over the past, almost 2.5 years of going through all this cancer shit. So my understanding, is that there was an Austrian study done that found that people that had breast cancer that were postmenopausal, whether or not that the postmenopausal means that you're naturally postmenopausal, or that you're postmenopausal due to being chemically induced into menopause, which that was me. The Lupron put me into menopause in a couple of days. So if you're postmenopausal and you do the Zometa infusions, there's one of two ways to do it: either every 6 months for 3 years, or something else that's shorter than 2 years or 3 years. But I don't remember now because I don't do that. So, but there's two different timelines that you can do it. That it would reduce the risk of the cancer traveling potentially into your bones. So when you're on tamoxifen and stuff, which is funny because, well, maybe the aromatase, I don't know. Tamoxifen has a side effect that it could deteriorate your bone qualities or bone strength or whatever. So before I had my first Zometa, they had me do a bone density test, which isn't hard to do. I mean, it's not like invasive at all. It's like kind of like just doing an X-ray to check me to see what my bone density was like as a baseline. Haha, as I say that, that's how I found my cancer, was from a baseline test. But they did that to start off with to see how things were going. And then I had another bone density test last month after 4 Zometa infusions to see, like, you know, what kind of impact has it been having. And it checked for 3 different things. So the Zometa, again, reduces the risk of you having osteopenia, or I don't know if I'm saying that right, or osteoporosis. There also is a cancer fighting effect to the Zometa also, which I didn't realize actually until recently. I thought it was solely for the bone thing, but it does something basically that, you know, from my understanding, if the cancer were to come back, it likes to go to places where there's a lot of calcium build up, which is your bones. The hormonally, I should say, if you have hormone positive breast cancer, which I did. Mine was estrogen and progesterone positive and HER2 negative. The cancer cells like find areas that are concentrated to a lot of calcium being produced and tend to go there because they like that. I don't know why. And again, that, you know, once it's in your bones, that's like not good. So yeah, that's what the Austrian study apparently found in my Cliff Notes version, which is why I do it. Not everyone, actually, out of all of the people that I have talked to in breast cancer support groups and things, I think I'm the only one that I know of that is doing the Zometa infusions. I don't know if it was a recent study or whatever, but my old oncologist, I mean, she's a brilliant woman. I just didn't really click with her personality-wise. But she was the one who told me about it, and I think it's kind of routine. Sorry, my head is pounding. It's kind of routine. It's one of the first things that starts after the infusions. Like, after some time goes by, my head starts to really hurt. So bear with me here. So my oncologist is really like on top of new studies and stuff, which is how she found out about this. And I think, like I said, it's kind of protocol for her patients, but it's not like that for everyone. I'm hot. I gotta take my hoodie off. So that's the point of the infusion in the first place. So before you have, so it's every 6 months. So this is actually the first time I've had the Zometa without having a Lupron. I was on Lupron for 26 months, but I stopped it 3 months ago now about, and knock on wood, haven't gotten my period. So there was no like, oh, at the end, oh, yeah, just one more thing, and then they showed the Lupron in your arm. But I didn't have that this time, so hooray, that was nice. I just wanted to get that all out of there today. So how they do it. they've got to make sure that you need to have labs done before you get the infusion. They won't allow you to have the infusion done unless you have lab work done, blood work done first. I asked today, which is funny because it's my 5th Zometa, and I only have one left, and I'm like, so what exactly are you looking for in the blood work? Which I probably should have asked like 4 times ago, but when everything is happening and like everything was so fast, like I was diagnosed in July, my double mastectomy was in August, I started tamoxifen in September, I started Lupron in October, and I started the Zometa, I think, in December. Around there, like boom, 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 boom. It's like, there was just so much stuff, and it's just hard to, you don't ask a lot of questions. It's just like a lot of stuff, and like, I shouldn't say you do ask questions, it's just like, you can't, there's no time to hyperanalyze. It's like you have to just get in there, get the cancer out, and get on a path to wellness. So I asked today, like, what does the blood work even look for that I can't have the Zometa until you get the blood work back? So when they schedule it, what they do is, like this morning, for example, I had an 8:30 appointment for blood work, a 9 o'clock appointment with the oncology nurse. And in the beginning you meet with the oncologist, but over time you meet with her nurse or his nurse, their nurse, whatever. And then they left actually an hour for me to meet with the nurse today because it was the first time I've ever met that nurse, because like I said, I just switched oncologists. I feel like when I was at Newton Wellesley, I'd have like labs at 8:30, appointment at 9, and then like 9:30 I feel like would be the Zometa. I could be wrong, but I feel like it was a half-hour appointment and not an hour. And that appointment basically gives a buffer of them doing the lab work and getting all the, results back so that you have time before you actually go for the infusion. So, so in the past, when I go, like this, well, I'll just say this morning, whatever, they did a weigh-in. I actually weighed in higher than I've ever weighed, ever, even when I was pregnant. That hurt. That was tough. And she had me take my shoes off. And I've been like working my ass off. Like, I've been at the gym, I've been walking, I've been doing weights, I've been exercising more than I probably like ever have. Like ever. And it's so frustrating when like I'm doing all this stuff and I weigh in and I'm like, are you fucking kidding me? In the beginning, they're like, don't worry about weight loss. Because, like, your whole goal is just to have the cancer go away. But then when you're actually, like trying, I mean, granted, it's January, so it's after the holidays, and I've been eating, like, shit. Not all the time, but I ate far less Christmas cookies than I usually eat. It's just frustrating because all the meds just kind of work against you to like have your metabolism slow down so much that, like, if this were 10 years ago and I worked out the way I have been, like it wouldn't be I wouldn't be gaining weight. It's just frustrating. So they weighed me in. And then took my blood pressure, which was great timing. I'm like, should you do it the other way around? Because like, I would think your blood pressure would be higher after you weigh in. But my blood pressure actually was relatively normal. So that's great. I mean, I am on blood pressure meds. I avoided that for as long as I could from diet and exercise, and then just hit a point where diet and exercise just weren't cutting it. And that was after I had cancer. Yeah, I was never on meds for blood pressure until, not because my blood pressure was high, just because I was able to control it with like diet and exercise and stuff. And then when all the cancer stuff happened, I was on other medications, and I had the kidney stone, and I think I had COVID. There were just a lot of things that were moving on, and they're like, don't beat yourself up, because if it's just a genetic aspect to all that too. And one thing I'll say too is like my sugar was high again today. And I did take a fasting, because she's like, oh, well, maybe you had some alcohol. This is so annoying. She's like, maybe you had some alcohol or something, and that's what pushed your glucose up. And I'm like, I hardly ever drink anymore. I'm in two camps that sometimes I'm like, you know, wine is hormones and I don't want any part of it. And then there's other days where I'm not days, like, it sounds like an alcoholic. I really hardly ever drink. Like for New Year's that I buy a bottle of Prosecco or something and then like, you know, it's just sitting there. So I'll have like, you know, 2 or 3 mimosas or something, but that's like, I'll do that once and then like that'll be it for like 6 months or something. But I didn't like that she's like, you know, maybe you had a glass of wine you don't remember. And I'm like, I feel like I would recall if I had alcohol, especially before going in for like lab work and a Zometa infusion. Like I'm not gonna have a drink the night before because I don't want anything else screwing up, you know, the flow of what's supposed to be happening. I didn't like that comment. That was rude. The people in the lab there just are not as warm and fuzzy as the other place, but I don't know, me with bigger hospitals, I feel like they're just more businessy. At this point, I've been through so much and I only have one more Zometa, so I like take what they say with a grain of salt because I know my body like inside and out, and I know I didn't have any friggin' alcohol, and that's not why. But anyway, so my blood pressure was relatively normal, which was great. So when you make your appointment, like I said, that's how they're spaced out. You make the appointment for the labs. So you'd go, and I don't know if they're all like this, but this is my experience with the 2 cancer centers I've been in. You go in the cancer center, you don't like go in the regular lab thing on your own. Like you get like a fast pass to the lab, but everything is through the cancer center. So you go in the building, in the hospital or in the cancer center, whatever, and you check into the cancer center, and then they call your name once to go get your labs. Then you go back out into the waiting room, and then they call your name again to go see the doctor or the nurse, and then you go back out into the waiting room. And this place had a separate waiting room that was for just the infusion center. Like that's for the really special people, you know? And then they call you in for the infusion. Today I was just waiting, like I waited a half an hour. That annoyed me too. I waited a half an hour to go in for labs, and it was like time to see the nurse, and the chick came out and I'm like, I haven't had my labs drawn yet. And she's like, you're sitting in the wrong section, you must have missed them hearing you. And I'm like, the place isn't that big. I'm literally like, I don't know, 20 feet or something from the door to the lab, and I'm like, no one called me. I would have heard. Like I don't want to be here and I'm paying attention. I want to get this shit over with. Like no one called my name. And she's like, oh, you probably didn't hear. I'm like, no, you probably didn't fucking call me, and that's why I didn't go back there. So everything got pushed back and they weren't thrilled about it, but like, whatever. So everything was running late. So I go in to have the lab work done, and they check a variety of things. They do like a metabolic panel, I think, or whatever the fuck that's called. And they basically are looking for your kidney levels and your liver levels to make sure everything is normal. Because if there's any, like the Zometa gets flushed through your kidneys, which is, you know, part of why you have to like super douse yourself with water after it's over to flush it out of your system and make sure there's nothing wrong with your liver, because your liver processes all of the crud too. So they won't do the infusion if those levels are you know, questionable or something else is going on. So that's why I have to have the labs done beforehand. So when I went to have the lab work, I mean, certainly I've been poked and prodded enough, whatever. But she went to put like at the old place, they would do labs in the crook of my arm. And then I'd leave with a little, like, you know, tapey thing on, and I'd go in for my infusion. And then, I mean, if you see the pictures, my vlogs and the pictures that are on the Facebook page, and I'm going to put a bunch of pictures, by the way, up on the invasive ductal carcinoma Facebook page. Same name as this vlog. Just because I can't put stills on YouTube, and I'm not going to take the time to edit it into this. Sorry, you can go to Facebook and find it. To just show you like what the room looks like, and like what I look like when I'm all hooked up, and you know, I didn't take video of that today, but I'll put a still up as a thumbnail, but I'll show you other pictures of like what to bring, that kind of stuff. But you'll notice that in the other place, they always use a vein in my hand to do the infusion. So that's what I'm used to. So when I went to get the original labs done, she's like poking around trying to find a vein on my hand. And I'm like, well, if you put that there for blood work, like where are you going to go for the infusion? Because I'm used to having the infusion done in my hand. And then like everyone's all freaking confused as to what the hell to do. And then it's like, well, why don't we just use your other arm? And I'm like, well, then we have to go into the conversation of I've had 6 lymph nodes removed from this side. Everyone but my breast surgeon says like, don't touch this side because lymph node removal. So like, what do I do? Meanwhile, I have like tingling in my fingers and lymphedema in my left hand and not so much in my right hand because you keep poking and fucking prodding my left arm and not my right arm. But I have to be like, super careful with the right arm. I don't understand the logic behind that. And my breast surgeon, she's the one who removed the friggin' lymph nodes, said to me, like, if you want to get a tattoo in your right arm, like, go for it. So who the hell knows? I don't get the logic behind all that kind of stuff. I mean, I understand that they would stay away from it because you've had more lymph nodes removed, and if something went wrong, you've got less lymph nodes to, like, clear all the shit out of your body. But you take that versus having, like, 26 injections into your arm and then all these infusions and whatever. So anyway, so she did it in my hand, and she's like, they have their own system. I'm like, whatever, fine. And it was just uncomfortable. Like, I feel like in general, like, I'm just used to having stuff done here, and like, I don't know, maybe you have more muscle or something, but I don't know what it is. It just hurts more in your hand. So yeah, so she did that. So I got a nice little bump on my, not bump, but like my veins a little swollen on my hand. And then I went out and yeah, sat, and then they called me in to talk to the nurse about like whatever. It's funny because they asked me, because I was just there last month, and they asked me if I wanted to have her do like an exam or anything, and I'm like, I don't think so, because I was just here last month. Like, my right boob is starting to bother me. After the original surgery, they have like, I think they're called dog ears, just the way like in the middle part, the way it heals. And my left side got fixed in January of last year. So, oh my gosh, almost exactly a year ago. That's weird because flooding, we'll get to that in a second. This backdrop is not the home I've been living in for most of my Zeta infusions. There's so much going on. Sorry, that distracted me. Yeah, so she asked if I wanted to have her do an exam. I'm like, I was just there. I don't really think I need to do that. Oh, the dog ear thing. Like, so I've been having some pains in my right side that I know I assume are just like cosmetic, not cosmetic. They're not like cancer things I'm concerned about. It's just like, I feel like he needs to like shove this boob over more or do something. Whatever he did to the left side, I feel like needs to get done to the right side, because it's starting to hurt now, like where the scar tissue on the inside, I can almost feel the thickness of the scar tissue, and like he made that go away on the left side, so I feel like he could do that on the right side. But I just have zero desire to have another surgery right now, and it's not like it hurts me that much. So I'm just gonna like hold off as long as I can. And I go back to plastics the end of this month to talk about nipple tattooing, which I'm certainly not doing if I'm having another surgery to fix stuff on my right side, but at least it's a conversation that needs to get started about the nipple tattooing. So the point was, like, I didn't need to put a Johnny on because I said I don't, I just they just wanted me to meet the nurse and just talk to her and whatever. So we talked and stuff, and then even when I was talking, she went over anyway, and she felt along the sides, and I kind of liked that, actually, that she was proactive to even like feel along the sides here, even though I wasn't the one who brought it up. I like that she would, I prefer that they do that than like do nothing at all, just to make sure and feel around. Granted, I had, like, I'm wearing my True & Co. bra and stuff, but it's so thin, like, I'm sure you'd feel something around it. And it's funny how they feel around, too, because I never had a lump in the first place. So, like, when they feel around, I almost feel like, what the fuck is the point of what you're doing? Like, if I didn't have a lump the first time, if my cancer came back, would I not have a lump again then, too? Like, you can feel all you want. I had a full friggin' breast exam literally, like, a week or two before I was diagnosed. And they're like, oh no, you're good. And I wasn't. Yeah, people just, how'd you find your cancer? Oh, I had a lump, I had a lump. I never had a lump. That's such a misconception. And it's not even like my tumor was small, because it really wasn't. If it was smaller, I probably could have had a lumpectomy, but that was so not on the table because the tumor was so big. So, yeah, you can't equate like just having a lump, like assuming that that's what's gonna happen. I don't mean to make you paranoid. It's just that like her feeling around is not the only way. Like, part of the reason why I'm annoyed that I can't get imaging done until 5 years out. But anyway, it's another conversation. So, talked to the nurse, then went back out into actually no, I scheduled my appointment for the next Luprons while I was waiting because the room wasn't ready or whatever. So I made an appointment for 6 months from now, which will be my last, oh my God, I said Lupron, Zometa, sorry. I made an appointment for 6 months from now, which will be my last Zometa. So July 15th, July 15th will be my last Zometa. And there's no like, well, you're going to get 2 more or something. Like, no. The study and everyone has said it's every 6 months for 3 years, period. So it will be 3 years, it'll be 3 years since diagnosis on July 9th. So July 15th is my last Zometa, and hallelujah. I know I celebrated a lot when I had the last Lupron, and the tamoxifen you're just on for so long, so like I feel like celebrating when that's done is just going to be a long time from now, so it's not like, some quick thing to celebrate, like, something after 26 months and something after 3 years is one thing, but waiting 10 years to have a party because you're off tamoxifen or whatever, or like, no. It's down the road. So I made the appointments, and then the next 3 again, where I get labs, see the oncologist, and then do the last Zometa. I made those 3 appointments, and then like back to back. I always take the day off of work, by the way, when I have that appointment. The Lupron, I feel like I could go to work afterwards and be okay. I would just be a little bit sore. Sometimes I was tired, but the Zometa is such a big, like, I mean, you're there so freaking long. I didn't leave till almost 1 o'clock, and I got there at 8:30. So I took the day off of work, and I've done that before too. And then I might need a day working from home tomorrow. It depends. Like, I'll go through the timeline as we get there, but I haven't hit the point yet where the fever starts to set in yet. That usually takes 24 hours to set in. So right now I'm skating on the when did the chill start, because that's usually right about now. So all right, so going back to the timeline. So then I go back out into the waiting room after I made the appointments and wait to get called in to the infusion center. And the place is kind of a maze in the new place, so I couldn't quite get my bearings. At the old place, it was just like you walk in this room, it's pretty cut and dry as to where stuff is and where you're going. What I found interesting is that at Noon Wellesley, it's kind of an open floor plan in their infusion center. Like when you go in, it's like one really big room, and you see a whole bunch of chairs, and there are curtains in between people, and if I guess you had to be closed off, you could. But like you walk in and you see all these other people that are sitting in the same place as you are, and they're having their chemo or whatever they're having done. This place was not like that. It was, well, I went to one of the MGHs, although Newton Wellesley is an MGH too, but they were individual rooms, which was interesting. So you don't see the other patients. I don't know if that's good or bad. It just is, which I just thought was interesting. I did not go with anyone today. I didn't drive myself. I think it's a very bad decision if you drive yourself. I would not do that. You just get tired afterwards, and it's just not, just get a ride from someone. I used to have a friend or somebody come with me, well, a friend come with me to sit for the infusion. I haven't done that the last 2 times. The last time I meditated the whole time I was there. So, maybe for the last one I will, but I did the same thing for today. Like I had someone drive me there and pick me up. But I didn't feel like I needed to have anybody there. I like had been through it so many times or whatever. I don't know, just went like it was a regular appointment. The Claritin, I don't want to forget to mention the Claritin. It was a while before I heard I've never heard this from a doctor. I've only ever heard it from people that have gone through Zometa infusions in support groups who said that if you take Claritin before your before the Zometa, the morning of the Zometa, and like a day or two afterwards, that it makes your side effects not be so bad. No doctors ever told me that was a thing. So, I mean, for me, it's like it couldn't hurt for me to take Claritin. So I'm like, all right, I'll take it. And I don't know how much is accurate or how much is just like, you know, psychosomatic or whatever, but whatever. I did, or that it's you've gone through the infusion so many times so you get used to it more each time. I don't know, but I did notice a decrease in my symptoms after taking the Claritin. The side effects hit me later. It took like almost a full day for them to start to kick in, except for the chills. That usually happens like right around now. But the fever took a full day for it to kick in each time after I took the Claritin, and it only lasted like a day, day and a half. Whereas before, the first, I think 2 or 3, when I didn't take the Claritin, the fever lasted like, it's like I had the flu for like a couple of days and I was like down for the count. So, I don't know. I mean, if you don't have adverse reactions, I don't know. I mean, there's nothing, like I said, for me, there was nothing bad about taking the Claritin anyway. I think because it's an antihistamine, but there's something specific about Claritin and not like Allegra or Benadryl or something that makes it different. I don't know. That's just what I've heard, and I tried it, and I've noticed a change in my side effects, so I did that. But no other things beforehand. Like just made sure I had a good breakfast in the morning. It's long you have to fast. If anything, don't fast for it. You need to like make sure you've got like energy and stuff, and hydrate. Like always, you know, you have to just make sure that you're hydrated. So I usually have, which could explain my sugar too. I usually have either like I did have a Gatorade today, like a Gatorade or like a liquid IV or something. I was gonna make a liquid IV today, and I thought that the liquid IV might increase my sugar, so I just drank a bottle of water instead. Or what am I missing? I don't know, any kind of like electrolyte thing, whatever, just enough to keep you hydrated. The other thing I want to mention is like what to bring, because these are all things to get ready for beforehand. I didn't really do that chronologically. So clothing wise, depends on time of year. You know, I have my hot flashes and stuff, and my appointments are usually at times of day when my hot flashes aren't like as big of a deal. But in general, you're having an infusion, and for me, I have it spaced out over time. So it's room temperature liquid going into your body, so I tend to get cold. So I usually, like you just saw, I had my hoodie with like something like short sleeve or sleeveless underneath. When I look back at my old vlogs, I was wearing t-shirts, but that was like when I had the Zometas, because one's always in the winter and one's in the summer. So when I did the summer ones, I just wore a t-shirt. But I thought that the what do you call it? The blood work was going to be here and the Zometa would be here, so that once the blood work's done, I only need to have my hand available, which is why I wore this white hoodie that I have. But if you notice on the hoodie, the sleeves are not tight, but they're not like super loose either. And that was kind of annoying today because they ended up putting the Zometa up here in the middle of my friggin' ass arm. So my sweatshirt had to be pulled up to here. So I had to like sit for over an hour with my sweatshirt like pulled up here, and it was just kind of uncomfortable. So I'd say wear a loose fitting top, you know, just in case you get hot. You can, I wouldn't say hot, I would just say for access, I would wear something short sleeved underneath. But they can always give you a blanket and pillows and all that stuff. So what I brought, you should bring stuff. Definitely bring a phone charger, because when I went today, I was planning on meditating the whole time, and I got there, my AirPods were dead. So I'm like, marvelous, this is great. It's just kind of that kind of day. So, you know, headphones, AirPods, earbuds, whatever, charger for your phone or the AirPods or whatever. Remember to try to, if you have earplugs that you're charging, do it before the day of the Zometa infusion. Lip balm or chapstick, just cause I don't know. it gets dry, whatever, and you want to, you know, make sure that you're comfortable. I always bring a book. I never read it because your one hand is always like, you can't really move it much because you've got stuff attached to it. So I always bring a book, but I never read it because it's hard. It's awkward for me to read with one hand. The whole point of the Zometa and all this shit is that it makes your hands kind of arthritic, and like it's hard to hold a book and turn pages with one hand and stuff. You have to keep in mind that for the pretty much the duration of the Zometa stuff, you're going to be one-handed. So you have to think, unless you have somebody who goes with you who's going to turn the pages every time, but not the case for me. So you got to make sure that you can if you're going solo, that you do things that you can easily maneuver with one hand. Oh, coconut water. That's what I was thinking of. The other is not really like an electrolyte, but I bought a big thing of coconut water, and I brought that with me, or bring a water bottle or something. They have water there, but then you'd have to ask them to like refill it all the time. And even though like for me, I have a saline bag too that's done, which I'll talk about in a minute. But I still get thirsty, whatever. So having the water bottle or whatever you have to drink is key. I would stay away from coffee and stuff because it's like dehydrating. What else do I have? Oh, scrunchie, just in case, although I don't think I used it today. Reading glasses because I can't see my phone very well. What else did I have? Oh, and I brought a protein granola bar. When I met with the nurse, she said that, because I know even the other place has like graham crackers or like saltines or something if you want them. And the only reason I did that was because the timing wise, by the time they started the infusion, because you're there for so long, depending on how far you live from the hospital or the cancer center or whatever that you're going to, by the time you actually get to the Zometa part, like it's time to eat a lunch or some sort of meal. So, again, hard to eat a meal with one hand. So, I just, you know, took a protein bar figuring that'll just get me through, and then I'll just eat a meal like right as I leave. And I mentioned, I mentioned something, whatever, to the oncology nurse, and she said, she's like, well, they come around anyway with a tray of food. And I'm like, what? And they're like, yeah, they have a cart that comes around if you want food, like a meal food. And I'm like, seriously? No, she said tea. Sorry. She said they come around with like tea and snacks or something. And I'm like, that's pretty cool. So they didn't come around with tea, but they did come around with something. I'll hold on to that little nugget because that was my happy ending, was what they brought on the cart. All right, where am I? So you go in the room. The chairs are much nicer at New Wellesley than the place I was at today. Just the way they recline, they're again, it's very like, it's not as warm, comfy, cozy. Even the blankets, I don't know, like they were heated, which was nice. It's just nice it feels like you just have like a nice warm hug or something when they give you a blanket. But they can't actually start anything until they get the okay from your labs and stuff. And again, there was confusion with mine today just because my old oncology nurse had retired and the orders were through her and blah, 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 blah. I don't need to get into all that, which is a pain in the ass today. So it took a while for them to get started. And then there's the discussion of how long to infuse it through your body for. So if you don't say anything and don't know otherwise, they'll probably just infuse it through 15 minutes. I will say that don't do that. You can if you want to, but no one needs to be a martyr. 15 minutes is a lot for that kind of infusion. I mean a lot. I don't mean a lot. It's actually not enough time. It's a lot, like it's a lot on your system to have it infused through in only 15 minutes. So I have learned over time to ask for the most amount of time that I could possibly have it infused for. So in my 4 appointments to have the Zometa done, I've asked them what the most they can do it for, and they say an hour. And I've read from other patients and stuff for cancer survivors that have said that they always do theirs over an hour. It's gentler on your system to do it over an hour. And then I know that they have a saline bag too. I can't recall if they did it at the same time as the Zometa or if they had done it after. I don't remember. I truly don't remember. But that was the time of advocating today, because she said, oh, I told the nurse that I wanted it done over an hour. And she's like, okay, that's fine. Just let him know. So I go in there and she goes to like hook everything up. And I'm like, just want to make sure like we're all set up to have this over an hour. And she's like, an hour? She's like, we don't do that. And I'm like, what? What do you mean? She's like, the infusion's 15 minutes. And I'm like, oh no, 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 no. I'm like, my infusions have been over an hour. I know you can do it over 15 minutes, but I don't need to be a martyr. I don't really feel like being in any more pain than I need to be in, or discomfort. So I'd like it done over an hour. And she's like, well, we just don't do that. And I'm like, no, this is my body that has had it done 4 times over an hour. I'd like it done over an hour. Or I don't even say I'd like it done over an hour. I'm like, it needs to be done over an hour. Like, I've done that 4 times. I don't know why it's so difficult that when you plug it in, you just plug in 100 instead of whatever time that you plan on doing. But it's my body, and this is what you're doing to it, but you're going to do it on my fucking terms, and I know that it can be done because I've done it for the past fucking 4 times. So then she leaves, and there's discussion had, and then I feel like she's, like, pissed off at me because, like, she had a very difficult time finding a vein today. Anyhow, advocate for yourself. If that were my first time, like, oh my gosh. But no, I know by now. And I said, like, about the saline, and she's like, oh yeah, we don't need to do that. I'm like, you don't need to do that. I'm like, but every time I've had it done, I've had saline pushed through first. And I'm like, I know that my body is very sensitive to medications and stuff. So like, this is what works for me. So I'd like to have this done again. And she's trying to convince me like that that's just not a thing. And I'm like, it's not my fucking first Zometa rodeo. This is a thing. And I want to have the same thing done here that I had done there, just here. So she leaves, talking, whatever. And she's like, well, we look back at your records and you've never had it infused over an hour. And I'm like, so then tell me how long I had it infused over. And she said a half an hour. I'm like, that's a load of shit. Because I know the timeline of how long I had been there. You don't forget this kind of stuff, people. And then she leaves again. And then she comes back. Long story short, she said that my Zometas have only ever been 45 minutes. And the last 15 minutes had been a saline, like, wash through. I'm like, okay. Even if that's not what it is, then I feel like it's a better compromise than a 15 fucking minute Zometa infusion. So she ran it over 45 minutes. And then the last 15 minutes, like when she hooks it up, there's the Zometa bag, the zoledronic acid bag, and then there's the saline bag. So when the drip is done for the Zometa, it beeps. I feel like I'm fast forwarding again, but it beeps, and then that tells them to like shut it off, and then they start the saline, and the saline kind of just like helps push everything through. She kept saying to me, she's like, well, you just drink a lot of water when you get home. Like, drinking a lot of water is not the same thing as having a bag of saline flushed through your system. And like, it's saline. It's not like I'm asking to put like freaking like cocaine through my system to make me not feel anything. Like, it's fucking saline. And I've had it 4 times done before. Like, it just made me mad. I'm like, I shouldn't have to fight still after all this bullshit. I'm like, I should not have to make a thing about like, this is what has been done. This is what works for my body. Like, do this. And they're trying to like tell me, no, this is what we do. I'm like, no, this is like my body. This is what we do. So she was trying to put the needle in my hand near or using a different vein as the other one, and I'm like, glorious. So now I'll have like 2 things in my hands. And she was having some difficulty. I don't know if she was pissed off at me or whatever the hell was going on, but when she put it in, like, I felt this really bizarro feeling, and I look over and there's like a bump on my hand, and I'm like, what the fuck are you doing? And she's like, oh, there's just a bubble. I did blah blah, something with the veins forking and whatever. And I'm like, what? So I'm like, I don't want you to infuse it through that because there's a bubble in there. Like, now I don't need fucking acid going into my hand when there's a bubble there. So anyway, she closed it up. I think she was embarrassed. She closed it up, and she did not want to go here. I don't know. They want to start. There's probably some science to it that I don't know, whatever. But she wanted to like start with my hand, then move her way up. So the weird thing this time was that my I have so many freckles I can't tell, but the infusion spot, the needle was like in my forearm, which is just weird. And something I'm not used to. So like it's my arm is like really sore because I'm not used to having a needle in my forearm like that. But they put the needle in there and they tape it down, and then once they get the okay and everything, then they, you know, plug in the Zometa drip, and you know, she asks if you want anything. Again, make sure you've got water. I always ask for a warm blanket because it's warm and snuggly. And I put my feet up with they give you, the chair reclines. And I asked for a second pillow because it was just not as comfy a chair as whatever. And you're sitting there for a while and you can't really move. Again, make sure though that your AirPods are charged if you're going to bring them, because last time I had it done, it was pretty uneventful because I purposely, this is how I know too, like I purposely put on an hour meditation. Like I can filter them through how long they are, and I'm like, I want a meditation for the duration of the Zometa, so I'm not even like in the zone of this shit all happening with this crap that's hooked up to me. Like I'm just in the zone of like meditating and being all like super chill, as this is just happens to be happening on the side. So it was frustrating that my AirPods weren't working and I just wasn't super in the zone. But once I got them charged and plugged them in and then got something going, it ended up being like a 20-minute meditation or something. And I might have even fallen asleep because I just remembered like hearing the beeping noise that the Zometa was done. And I'd say it feels like it's 1, 2, 3, but it doesn't. I mean, there's a lot that came back to me this time. I don't know because because I was in a new place or something, but just like me having cancer at all and even being there just like hit really hard today. I don't know why. I was in a new place, so it was almost like starting over again. Like I don't want to start anything new in the whole cancer process. I want that to be like in the rearview mirror, but like I know it was the right call to find a new oncologist for me. The other weird thing is that my last winter's Zometa was right before my second reconstruction surgery. And then, in case you're just catching up, like a week after my second reconstruction surgery, my apartment flooded, and I lost like all my shit and I had to move. And that was a bit traumatic for me. And the weather outside was frightful. Blah, blah. It was like, it's snowy out, but it was like slick and sleeting and stuff, and it just brought back a lot from the really cold day that led to my pipes. Well, it wasn't even my pipes, it was the pipes next door bursting, but that's a longer story, and you can go back to last year's vlogs that happened on February 4th. So just all of that was coming back to me, and it was just a lot. And I cried twice. Once before the nurse came in, and then once when I was in the infusion center after the nurse left and things started going. Not hard cry, just like, I don't know, just had an emotion. Anyway, so yeah, so the drip went through for the Zometa stuff, and then it burned pretty much the whole time that the Zometa was running. That does not usually happen to me. It might burn a little bit when they first put the needle in, but like I said, I don't know if she was pissed or just distracted or whatever the story was, but this was not my best experience with needles in my skin. Last time, like that, I don't recall it burning like that, like especially not for the whole time. And I told her it was burning, and she's like, "Oh, it'll go away," and like didn't go away. And then I get just kind of resigned that I'm like, what am I gonna do? Have her find another spot to put it in, and then I don't know. I just whatever. It's over now. So then she comes in, shuts off the Zometa, and then the saline starts. And then once the saline starts, you get really cold because, again, it's like a full bag of the Zometa isn't like nearly as much as the bag of the saline. And it goes through much faster because it's only 15 minutes of the saline. Like you see it like, dripping down and stuff. And the speed is way faster than what the Zometa gets pushed in through your body. And then once there's almost like like a weird psychosomatic thing with the saline that as that's coming through, it's almost like it's washing everything out of your body and like let the Zometa go where it needs to go, and all the other stuff can just like, you know, go through my organs and get peed or pooped out or however that works. And then another nurse came by and pulled the little curtain out, and she's like, would you like some lunch? And I said, pardon me? This is the happy ending part. And she said, I have a cart. Do you want some lunch? I'm like, oh, this is the cart. There wasn't any tea in the cart, at least not that I saw. What I saw were sandwiches. And it was so much better than the friggin' protein granola bar that I brought. So I asked her like what she had, and there were 4 types of sandwiches. I got turkey, and it's not like it was something like super fancy. It was like turkey on wheat with lettuce and tomato. But like when you're going through that, it's like it's like your mom coming and being like, sweetie, do you need anything? And then they had fruit cups, but then I saw there were strawberries in them, and so can't have that. And so she gave me chips, which I'm like, salt, like that's not what I should be having. But for this one treat, I'm like, this is what I can do. So I had the sandwich and the chips, and it was glorious. That was my happy ending. Like after all the drama, it was like the best freaking turkey sandwich that I've had. Because I can pop it, I mean, take some finagling to get the tape off and stuff, but I opened it up and I could eat it with one hand because it's cut in half, and I'm just like sinking my teeth into the soft bread, and it's just like nourishment. It felt really good. So after all the drama, I was very happy to end the Zometa day with a turkey sandwich. So where am I now? I'm at 51 minutes, but that's about right. She told me to take Tylenol as soon as I left. So I asked, my son was the one who drove me there and picked me up. So I asked him to bring Tylenol with him in the car, because I don't remember anyone ever telling me to do that before. So he brought Tylenol in the car, and took 2 Tylenol on the way home. They're just about wearing off now. So my appointment was at 8:30. Again, I left at like 11:45 or something. It usually isn't that late, although I feel like there's always something that slows things down at the cancer center. I don't know. There's a lot of people in the infusion center, unfortunately, and like something happens, it slows kind of everyone down. But yeah, don't plan on like making any big trips or something the day of your Zometa, because pretty much the whole day is shot. I do have to say that I'm usually way more tired when I'm done. I feel like I was tired like for like the first hour or so when I was finished, but like it's what, like, oh, I'm looking at my phone. It's like 7:30 or something p.m. right now or something, and I'm usually like tired down for the count, and I don't feel that way right now, which is good. I don't question it, but typically I'm really tired. I was supposed to tutor today, and at the time, like I was really tired, and I'm like, I couldn't do it in person tutoring. It was just too much. But my hand does hurt. My arm pretty much from here like on down just hurts. Like here hurts because I'm not used to having needles in this part of my body. And then the spot where they did the blood work hurts, and the spot that she messed up on hurts, and I can already see it starting to like bruise. So yeah, I mean, that'll go away. It just makes it kind of awkward when you're sleeping, because I normally sleep on my left side, and that's my left arm, so I can't sleep on my left side. So I don't anticipate getting a good night's sleep tonight, but whatever. So typically at around this time is when the chills start. I'll get super, super cold and start shaking and stuff, like shaking to the point that like my teeth are shattering and stuff, and just never have enough blankets on me. And I remember I had the Zometa infusion in this apartment. I'd been here for one other one because I've been here just under a year. So I remember like I didn't have enough blankets because all my blankets were like, they took all my clothes and stuff and brought them to get industrial washed, which is code for shrinking, or just some stuff disappearing. But I didn't have my old blankets, so I'm in a weird, like, it's weird for me right now because it's like when you have appointments like this, you want to like just go home and like cuddle with your stuff. And what sucks for me right now is that like all my stuff isn't like my stuff. It's new stuff, but it's not like it's not the stuff that I'm used to. Like the blankets that I used to cuddle up in, like I don't have those anymore. And I have new blankets. They just don't have that warm fuzzy vibe. As you can see, there's a theme here about the need for warm fuzziness, and that's just like kind of hard right now because I'm craving that, and it's just not here. I like my new bedding and stuff. I'm just not. It doesn't feel like home to me yet in that way. I love my apartment, but it just doesn't feel like home to me. My couch is not nearly as comfortable as my old couch. The way I would even lay on it to watch TV, I'm at a different angle, and it just doesn't feel right. I just can't get comfortable in the same way. So I just feel a little unsettled, physically and mentally right now. So maybe that's what's throwing me too, that like I don't have the chills yet because my body's like, I don't know what to do right now. Because like, what happened? This wasn't your home. Where'd this place come from? It's crazy. Crazy. I've been through a lot of shit, man. And then the fever usually starts 24 hours after I have the infusion. Because I'll feel like, oh, everything is so great. And when I first had the infusions, I would get the fever like at nighttime if I had the infusion done like in the morning. And then I remembered like I went a full day, and I went on like a Friday, and then I went to meditation on Saturday, and I was like, look, I feel fine. And then all of a sudden, like during meditation, it was like that I started like burning up. So I'll have to see what happens tomorrow. Maybe I'll even do another vlog tomorrow just to keep you posted on how things are going. But yeah, the fever usually starts the next day after 24 hours, and it gets alarmingly high, like 103 or so. Usually is on average, not average, but the highest, or I should say my fever gets like 103 and it like stays there. I think 103.7 was the highest I've gotten. And then it'll last for a day and a half, and then as quick as it comes on, like boop, it just stops, and then that's that. And then I feel like my joints are aching and stuff, but I feel that way before I have the Zometa too. It's almost like my body knows that it's coming, and the achiness could last like a week or two, but then it tends to go away. If you watch my very first vlog about Zometa, it's not that that's how the first one, from what I hear, always is, but the subsequent ones aren't as bad. So don't think that the way the first one was is how they all are, because that's not true. It does get better. I remember how bad the first one was, and it was awful. Just the duration, I would say, of everything was just awful. I still have like similar symptoms. They're just not, they don't last as long, and they're not as bad. So yeah, if you got scared after watching the first one, just know that it does get better. So yeah, she told me to take Tylenol for like 2 or 3 days, and then after that, like the fever should be gone and I should be good to go. So I don't know, I can't psych myself out that I'm not going to get a fever. I just have to like play it by ear and see what happens. So I'm just trying to chill and relax. I may just work from home tomorrow, but we'll see how it goes. Don't push yourself with any of it. And if you have questions, there's stuff that I didn't bring up, or questions you have, or clarifications on things I said, please shoot them in the comments below. I usually don't talk like that, but there's just been the most back and forth I've had is about the Zometa infusion. So I wanted to be thorough in 58 minutes and 40 some seconds, to make sure I covered as much as I could think of. So, like I said, maybe I'll just pop on quick tomorrow just to let you know how I'm doing. But don't hesitate to ask any questions that you have. There's probably something that I'm forgetting to have shared with you. Yeah, so that's what I got on the Zometa. So let's see what happens next. I don't know. We shall see. All right, everyone. Again, questions or comments, stick them down below. You can also like email me, though I'll never check it. I would say if you're gonna do anything like separate with it, like a DM or something, I'd go on Facebook and private message me through there if you have a question or something. Again, same name, Vasil invasive ductal carcinoma. All right, talk soon. Thanks. Bye.